Okay, guys. So continuing with chapter 22, we also are going to start with managing anxiety. Highlight the following. Anxiety is defined as a feeling of worry or uneasiness, often triggered by an event that is perceived as having an uncertain outcome. There are four levels of anxiety that range in the degree from fleeting worry thoughts to a full-blown panic attack. The four levels of anxiety are outlined in figure 22.6. If we go on over to page 775 in the second paragraph, highlight the following. Symptoms of severe anxiety include the following: hyperventilation, rapid pulse rate, excessive preparation, and confused speech. Also highlight that a patient with severe anxiety may lose control of his or her emotions and cry or scream. Under the emergency preparedness in the medical office, highlight that emergency preparedness is the process of making plans to prevent, respond to, and recover from an emergency situation. And an emergency action plan, highlight that an emergency action plan, an EAP, is a written document that describes the actions that employees should take to ensure their safety if a fire or other emergency situation occurs. Highlight that the purpose of an EAP is to prevent fatalities, injuries, and property damage during an emergency situation. The components of an emergency action plan. Let's go on over to page 776. Highlight number 1, the preferred means of reporting fires and other emergencies. Highlight that one or more of the following methods are typical used to report the emergency and or alert employees to the presence of an emergency situation. Please highlight A, B, and C. Number 2, an emergency evacuation plan. Please highlight A and the first and last bullet point. Highlight B where it says, for example, the immediate and complete evacuation of a building to a safe area is typically required in the event of a large fire. In C, highlight each of those bullet points. Also highlight that OSHA requires that specific guidelines be followed with respect to exit routes. And in C, highlight that a primary exit route is the quickest and easiest way to exit a building during an evacuation and is usually represented on the floor plan by a continuous solid red line with a directional arrow. Under figure 22.7 on page 777, highlight that an evacuation floor plan should be posted in multiple locations throughout the medical office, including each examining room, the waiting room, restrooms, the break room, and the offices. An evacuation floor plan should include the location of the following: an employee's current location, primary and secondary exit routes, manual fire alarm boxes, portable fire extinguishers, emergency exit doors, wheelchair accessible exit, shelter in place areas, and assembly areas. Highlight number 3 for the procedures for employees who remain behind to perform critical operations before evacuation. Now let's turn to page 778. Highlight number 4 where it says procedures to account for all employees after an evacuation. Also highlight at the bottom of that where it says most offices designate the patient login sheet as a means of accounting for patients in the event of an evacuation. On number 5, procedures for employees performing rescue or medical duties. Highlight that during an emergency situation, various rescue or medical duties may need to be performed by employees. These employees are often referred to as evacuation wardens. Now let's look under the fire safety in the medical office on page 779. In the second paragraph, please highlight the following. There are numerous ways for fires to start in the medical office. Examples include overloaded electrical outlets, heat-producing equipment that is too close to combustible materials, improper use of appliances such as coffee makers, microwave ovens, and stoves, improper handling and storage of chemicals, cleaning supplies, and other combustible materials, and arson. For the elements of fire, you just need to highlight that a fire needs 3 elements to occur: a fuel source, an ignition source, heat, and oxygen. For the fuel source, highlight that a flammable material catches fire easily, whereas a combustible material is any material that will burn. Highlight many items can provide fuel for a fire, such as paper, cardboard, wood, plastic, fabric, and flammable liquids. Common examples of fuel sources found in the medical office include the following. Highlight patient medical records, furniture, drapes and rugs, office equipment, chemicals used for sterilization and disinfection, laboratory testing chemicals, and trash. For the ignition source, the heat, highlight that an ignition source provides the energy necessary to increase the temperature of the fuel. Highlight open flames, faulty electrical equipment, hot surfaces, and sparks. For oxygen, highlight that the air around us has been about 21% oxygen content, and most fires only require an atmosphere of 16% to burn. For fire prevention plan, highlight that a fire prevention plan is a written document that identifies flammable and combustible materials stored in the workplace and ways to control workplace fire hazard. Highlight that a fire prevention plan reduces the probability that a workplace fire will ignite or spread, which helps prevent injury or deaths, keep the workplace safe, and helps to prevent financial losses to the medical offices. On page 780, for the fire protection in the medical office, highlight under the sprinkler systems that the sprinkler systems are usually located at the ceiling level and use water to put out or slow the progress of a fire. Sprinklers are activated by the buildup of heat in the fire area. Also highlight that only those sprinklers closest to the fire area are activated. Most sprinkler systems include an alarm system that alerts both building occupants and emergency responders when sprinkler activation occurs. For the fire doors, you need to highlight that a fire door is a fire-resistant door that is designed to prevent the spread of the fire from one area of the building to another. Under the fire extinguishers, you need to highlight that a fire extinguisher is a portable device that discharges an agent designed to extinguish a fire. Also highlight a few sentences below where it says to control or extinguish a small fire that has just started, and to protect an evacuation route that a fire may block with smoke or burning materials. A fire extinguisher should never be used to fight a large fire that is out of control. Now on page 782, please highlight Class A in Table 22.2. On page 783, in the second paragraph, please highlight the following. Fire code requirements specify the size, number, location, and type of fire extinguishers within a facility. Also highlight where it says fire extinguishers are mounted on brackets or installed in wall cabinets and are usually located along the normal paths of travel and near building exits. Highlight if a fire extinguisher is mounted in a room and it is placed near a door so that the fire does not get between an individual and an exit. Also highlight on the other side on page 783 where it says the acronym PASS, PASS, is used to help remember the steps involved in operating a fire extinguisher. P, pull out the pin. A, aim the nozzle at the base of the fire. S, squeeze the handle. S, sweep the nozzle from side to side. For an emergency response to a fire, please highlight the following. The acronym RACE can be used to identify the basic steps to follow in responding to a fire. Race against fire. These steps are as follows. R, rescue anyone in immediate danger of the fire. A, activate the alarm. C, confine the fire by closing doors and windows. E, extinguish the fire or evacuate the area. Please review procedure 22.1, 22.2, and on page 789 where employee training and education, please highlight the following. OSHA requires that employees be provided with education and training on an EAP. The training should include the following. Highlight each of these bullet points. Individual's role and responsibilities, threats, hazards, and protective actions, location and operation of manual activated pull stations and communication equipment, emergency response procedures, evacuation, shelter, and accountability procedures, location and use of common emergency equipment, and emergency shutdown procedures. Please make sure that you review the medical assistance role on page 790 and the terminology review. And again, make sure that you review all of the figures and procedures in this chapter.